Thank you. Well, what a cold managerial speech with no empathy for families from the Minister. I'd like to declare my register of interest as a practising NHS GP. We are disillusioned with the Scottish Government's stewardship of our NHS and the indifference shown by successive SNP health secretaries to many well-documented calls by local communities to support critical services. And here we are yet again. 12,000 people support Lynne McRitchie's petition to think again and reconsider downgrading University Hospital Wishaw's award-winning neonatal services. The Scottish Government remains unconcerned. Cabinet Secretary, look at the families in the gallery, look them in the eye and tell them the truth. You don't care about their opinion. Currently, Scotland has 8 intensive neonatal units. Under the Scottish Government's centralisation plan to abandon rural communities, this will reduce to 3. Glasgow's Queen Elizabeth University Hospital, Edinburgh's Royal Infirmary and Aberdeen's Maternity Hospital. Of course, the SNP has form when it comes to forcing mothers and babies to travel vast distances for care. In NHS Highlands, women in Caithness and Sutherland have faced round trips of over 200 miles to access obstetrics and gynaecology services in Inverness. Further along the Murray Firth, Dr Gray's Hospital in Elgin has not had a consultant-led maternity unit since Shona Robertson was Health Secretary. And over the past 5 years, the majority of Murray mothers had to face a 90-minute trip east to Aberdeen or an hour's trip west to Inverness. From Wishaw to the borders, from Murray to Portree, maternity services across Scotland should be provided with the resources they need to provide crucial care to newborn babies. Presiding Officer, Scotland is so much more than its 3 biggest cities. Over 4 million people live elsewhere, with around 1 million Scots living in rural and island communities. Services need to be designed, resourced and optimised accordingly. Being wedded to centralisation, apathetic to local needs, won't wash. The Scottish Government has also run roughshod over neonatal patient safety by the way of its May 22nd directive to Health Board, which limits the use of off-framework agency nurses. Now look, I understand the need to restrain the use of agency staff and control costs. But at a time when the Scottish Government has made a mess of workforce planning and soaring 6,000 nursing vacancies, the consequences of coming down hard result in unsafe staffing levels. The directive came into force on the 1st of July. So what's been the impact? Well, as of September the 17th, an off-framework agency, just one, tells me that due to new controls, they've been unable to place nurses in over 300 neonatal shifts since the 1st of July. And managers are openly saying that this understaffing will just have to be accepted and it's on the staff. In total, across general, medical and surgical wards over the same period, it's been unable to fill over 7,500 shifts because of the Scottish Government's directive. Now, we have neonatal intensive care agency nurses being brought up from London to Scotland to cover shifts. We're told that neonatal staffing levels in several regions are dangerously low. We know of a paediatric cardiac consultant whose cases were cancelled because of staff shortages that couldn't be backfilled on the new directive. The SNP, I'm just about to finish, the SNP is clearly heavy-handed, disregards the nuanced needs of families, causing distress and discontent. There's a lack of empathy, and it stamps its authority on patients and staff alike. It's crucial that we pause and listen, and I move the amendment in my name.
Thank you very much.